Hi everyone, welcome back to our channel. Today, we're diving deep into an essential nutrient that's crucial for our health, vitamin B12. We'll cover everything you need to know about its importance, symptoms of deficiency, foods that can boost your B12 levels, and how to treat deficiency if it occurs. 1. What is vitamin B12? Vitamin B12, also known as cobalamin, is a crucial water-soluble vitamin that is essential for various bodily functions. It plays a vital role in DNA synthesis. Vitamin B12 is necessary for the synthesis of DNA, which is critical for cell division and growth. Red blood cell formation. It helps in the production of healthy red blood cells, which carry oxygen throughout the body. Nervous system function. Vitamin B12 supports the health of nerves and contributes to the proper functioning of the brain and nervous system. It plays a role in the synthesis of myelin, a fatty substance that insulates nerve fibers and helps transmit nerve signals. Energy production. It is involved in converting food into energy by aiding in the metabolism of fats and carbohydrates. Homocysteine metabolism. Vitamin B12, along with folate, vitamin B9, and vitamin B6, helps in converting homocysteine into methionine, an amino acid involved in protein synthesis and various metabolic reactions. Elevated levels of homocysteine are associated with an increased risk of cardiovascular disease. Vitamin B12 deficiency can manifest in various symptoms, ranging from mild to severe. Here are 10 common symptoms. Fatigue, persistent tiredness and lack of energy, even after adequate rest and sleep. Weakness, feeling weak, particularly in the muscles. Pale or jaundiced skin, a paler complexion than usual, or a yellowish tint to the skin, jaundice. Shortness of breath, difficulty breathing or feeling breathless, especially during physical exertion. Neurological symptoms, such as numbness or tingling sensation in the hands and feet, paresthesia, muscle weakness, and difficulty walking or maintaining balance. Cognitive impairment, memory problems, confusion, or difficulty concentrating. Mood changes, irritability, depression, or changes in behavior. Vision changes, blurred or disturbed vision. Glossitis and mouth ulcers, inflammation of the tongue, glossitis, and painful mouth ulcers. Digestive issues, loss of appetite, weight loss, or diarrhea. It's important to note that these symptoms can develop gradually and may vary in severity depending on the extent of the deficiency. If you experience any of these symptoms, especially if they persist or worsen over time, it's advisable to consult with a healthcare professional for proper diagnosis and treatment. Increasing your intake of foods rich in vitamin B12 is essential, especially for individuals who may be at risk of deficiency. Here are some foods that are good sources of vitamin B12. Animal-based foods. Meat, beef, lamb, pork, and particularly organ meats like liver are high in vitamin B12. Poultry, chicken and turkey. Fish, especially oily fish like salmon, trout, sardines, and tuna. Shellfish, clams, oysters, mussels, and crab. Dairy products. Milk, both regular and fortified dairy milk. Cheese, especially Swiss cheese and other hard cheeses. Yogurt, plain yogurt or yogurt fortified with vitamin B12. Eggs. Both the yolk and white of eggs contain vitamin B12, making them a good source. Fortified foods. Breakfast cereals. Many breakfast cereals are fortified with vitamin B12. Plant-based milk alternatives. Some brands of soy milk, almond milk, and other plant-based milks are fortified with vitamin B12. Nutritional yeast. This is a popular supplement among vegetarians and vegans as it often contains added vitamin B12. When selecting foods to boost your vitamin B12 intake, opt for sources that are naturally rich in vitamin B12 or fortified with it. It's important to note that vitamin B12 is primarily found in animal-derived foods, so individuals following strict vegetarian or vegan diets may need to rely on fortified foods or supplements to meet their requirements. Regularly including these foods in your diet can help ensure an adequate intake of vitamin B12, which is crucial for overall health, particularly for nerve function, red blood cell formation, and energy metabolism. The treatment for vitamin B12 deficiency depends on the severity and underlying cause of the deficiency. Here are the main treatment options. Dietary changes. Increasing intake of foods rich in vitamin B12, such as meat, especially liver, fish, salmon, trout, shellfish, clams, oysters, poultry, chicken, turkey, eggs, dairy products, milk, cheese, yogurt, and fortified foods, like breakfast cereals and plant-based milk alternatives. Vitamin B12 supplements. Oral supplements. Most cases of vitamin B12 deficiency can be effectively treated with oral vitamin B12 supplements. Cyanocobalamin and methylcobalamin are common forms of oral supplements. The typical dosage for oral supplements ranges from 1,000 to 2,000 micrograms per day initially, followed by a maintenance dose as advised by a healthcare professional. Sublingual supplements. These are dissolved under the tongue and may be more effective for some individuals, especially those with absorption issues. Injections. For severe cases of vitamin B12 deficiency or individuals who cannot absorb vitamin B12 adequately from oral supplements, vitamin B12 injections may be necessary. These injections are typically administered intramuscularly into the muscle and can quickly restore vitamin B12 levels in the body. Identifying and treating underlying causes. If the deficiency is due to conditions like pernicious anemia, an autoimmune condition affecting B12 absorption, or gastrointestinal disorders that impair B12 absorption, e.g., Crohn's disease, celiac disease, treating the underlying condition is essential. Management of these underlying conditions may involve medications, dietary changes, or other specific treatments. Lifelong management. In cases where vitamin B12 deficiency is due to chronic conditions or permanent absorption issues, lifelong supplementation or regular injections may be necessary to maintain adequate B12 levels and prevent complications. Monitoring and follow-up. Regular monitoring of vitamin B12 levels through blood tests is important to assess the effectiveness of treatment and adjust the dosage of supplements or injections as needed. Follow-up appointments with a healthcare provider are essential to ensure that the treatment plan is effective and to address any ongoing concerns or symptoms. It's crucial to consult with a healthcare professional, such as a doctor or a registered dietitian, for proper diagnosis and personalized treatment recommendations for vitamin B12 deficiency. Self-diagnosis and treatment without medical supervision can lead to inadequate management of the deficiency and potential health complications.